The Corporate Accountability and Public Participation Africa (CAPPA) is calling on the federal and state government to urgently reform Nigeria's food system as part of efforts to curb the growing cancer burden in the country. In a statement issued on Tuesday to mark World Cancer Day 2026 with the theme United by Unique, the organization expresses solidarity with millions of people affected by cancer worldwide while advocating patient centered care and stronger prevention focused policies in Nigeria. CAPPA warns that cancer is becoming a major public health crisis, citing data from the National Institute for Cancer Research and Treatment, which shows that Nigeria records more than 120,000 new cancer cases and over 72,000 cancer related deaths every year. The group says beyond genetic and environmental factors, growing evidences links cancers such as colorectal, breast, and prostate to unhealthy diets and harmful food production practices. According to CAPPA, major contributors include the widespread marketing and consumption of ultra-processed foods, weak regulation of tobacco and emerging nicotine products, and the excessive intake of sugar-sweetened beverage and salt. The organization calls for stronger healthy food policies, including stricter tobacco and nicotine regulations, increased funding for tobacco control, mandatory salt reduction targets for processed foods, and the review of the sugar-sweetened beverage tax from the current 10 naira per liter to 50% of the final retail price. CAPPA further urges restrictions on the marketing of unhealthy foods to children and the adoption of clear nutrition standards in schools, hospitals, and other public institutions. Describing tobacco as one of the most preventable causes of cancer, the group calls for full implementation of the National Tobacco Control Act, the inclusion of new nicotine products in advertising bans, higher excise taxes adjusted for inflation, and tougher action against illicit tobacco trade. While commended the federal government's plan to dedicate pro-health taxes to cancer prevention and care, CAPPA warns that Nigeria's health system remains overstretched with about 40,000 doctors serving a population of over 200 million. The organization also stresses that the country cannot rely on treatment alone, adding that prevention-focused policies, early detection, sustainable health financing, and stronger accountability could save thousands of lives each year.